Yeah. We'll go live when you say, Chair.
Ready when you are. Let's go.
We're live.
Good morning, everybody. Welcome to the Performance Scrutiny Committee for Partnerships, which today is being conducted hybrid. I just got a little bit of housekeeping to read out. This Scrutiny Committee is being conducted remotely in accordance with the coronavirus regulations and the remote meetings protocol agreed by the Council, which will operate alongside the Council's standing orders to ensure that we continue to take democratic decisions in an open and transparent manner. I would remind members that this meeting is being live streamed to the public. Can I request that you all switch off your cameras and mute your microphones when you are not speaking to ensure there is no unnecessary background noise and to help with the audio and visual quality of the broadcast. The Council standing orders and code of conduct will apply at all times during this virtual meeting in the same way as ordinary meetings, and members should conduct themselves accordingly. Can I also remind members to ensure their chat function is switched on and to use that facility to indicate to me when they wish to speak on a particular item. Please do not speak until I invite you to do so, and remember to unmute your microphone and switch your camera on. For the benefit of everyone watching on the live stream, when I invite members to cast their votes on any particular item, they will do so electronically using the voting facility in the chat function. The votes will be automatically counted and are recorded on the system, but individual votes are not identified on the screen and in the chat room poll. Poll is not available on the live stream for public viewing. However, I will announce the numbers of votes cast for and against and any abstentions before I declare the result. As well as being broadcast live, a recorded version of this remote meeting will be uploaded onto the Council website for public viewing as soon as possible after the meeting. Welsh translation of the proceedings may also be provided upon request, and the images and the sound recording may also be used for training purposes within the Council. Might I also remind members that we are here to scrutinise the reports in front of us, and that any ward-based issues or operational issues should be taken up with officers outside of this meeting. Thank you very much, everyone, and welcome. May we start with apologies, please, Neil?
Councillors Whitehead, Baker Westhead, Jones and Morris.
Thank you very much. And for those watching in the room, we've got Councillors Jewett and Councillor Pym. And online, we've got Councillor Screen, Councillor Hussain, Councillor Davis and me. Brilliant. So before we start, are there any declarations of interest today? Just to note, although it doesn't make a difference in this situation, Fazina and I do sit on the Gwent PSB Regional Scrutiny Committee. So that's just to note, really. Okay, so let's start with item 3. Let's move on to item 3, the Gwent Regional Partnership Board Area Plan. Who do we have here today to represent this?
Hi, good morning. So Sally Jenkins, Strategic Director for Social Services Prevention and Inclusion, and I'll let Phil introduce himself.
Yeah, Phil Diamond, Head of the Regional Partnership Team.
Thank you very much, both.
So shall I just kick off, and Phil and I will just do a very short double act before then coming to members for questions, because
that would be wonderful.
Yeah, a lot of papers for people to have had a look at and possibly digested, although that might be a bit of an assumption. So we've previously been to committee with the Regional Partnership Board annual plan and the annual report, and this is a statutory requirement for us to come to all the scrutiny of the 5 local authorities and the Health Board to present this information, and then also to take comments, questions and challenge back in respect of the reports and the information contained within. Councillor Hughes is also with us today. Councillor Hughes sits on the Regional Partnership Board as the statutory member for Newport City Council and is also currently the Vice Chair of the Regional Partnership Board. So Councillor Hughes is also here with us to take any queries and questions. So just to be clear, that the Regional Partnership Board and the statutory framework for the area plan and the annual report is laid out within the Social Services and Wellbeing Wales Act 2014, and the work that the Regional Partnership Board is required to undertake is likewise set out within that legislation. The format and nature of this report is laid out by Welsh Government, and there is a requirement for this report to be submitted to statutory partners in the way that we are submitted today. So what we're asking of a committee to look at is the joint regional commitments within the area plan, and then to have some consideration of objectives. I suppose what we would particularly like the committee to consider today is the funding arrangements that there are under the Regional Partnership Board, and particularly the Regional Integration Fund, and the implications for those for the council, which are considerable. You will see from the papers that the Regional Partnership Board has a strategic approach across the 5 local authorities, the Health Board and the third sector partners, to a huge range of issues within social services. Everything from children with complex needs, mental health, learning disability, carers, patient flow through the hospital, reablement. There's a bit of a sense of you name it within social services, and it falls within the orbit of that partnership working. And that partnership working is absolutely crucial within social services in order for us to be able to deliver effectively. Now, for Newport itself, that doesn't mean that we don't have our own specific and individual services that then feed into this wider strategic picture. And I suppose one of the comments that I would make is that I think one of the challenges in this arena of work, likewise the PSB, which you've already referred to, is looking at where the differences fall between the regional and the local, looking at the differences in responsibility, and that can sometimes be really quite difficult. And I think that that's sometimes heightened by some of the challenges that we particularly have going into the winter, with the difficulties that we have in kind of working through the resources that are required for winter resilience in particular. The other element that I'm just going to touch on that isn't in the area plan but maybe of interest to members is that the Regional Partnership Board is currently looking at the priorities that we are focusing on, and we're looking at the priorities and undertaking quite a significant piece of work to look at how we really focus on what's needed across the 5 local authority areas to ensure we deliver the best social services with which what are inevitably limited resources, basically. Phil, is there anything that you want to add to that?
Thanks, Sally. I guess just to provide that reassurance, really, that the Regional Partnership Board is the partnership space for the 5 local authorities, the Health Board and the third sector, to come together, to collaborate and take forward joint solutions. Without the Regional Partnership Board, there would potentially be silo working. It's not a statutory body in the sense that it has executive powers. The RPB cannot direct local authority to make decisions in the same way it cannot direct the Health Board. But it is a partnership space which hopefully provides support to each of the statutory partners, especially around those joint issues, so that the challenges you face in Newport are taken forward collectively across the 5 local authorities, Health Board and the rest of Wales as well. So there's always good opportunities for good practice, but only just that minor point, really.
I don't know. Obviously, Councillor Hughes has got a view, so I don't know whether he wanted to go to him briefly as well, if that's okay.
Councillor Hughes, is there anything you'd like to add?
Just to reiterate, really, that we're working within 5 local authorities, the Health Board. It's very much a partnership. That causes its own difficulties in the sense that those different regions have different needs. We're talking about big urban areas such as Newport and quite rural areas such as Bournemouth, so it's not the same fit sort of suits all really in that situation. So it's really about getting that partnership to work well together, and there's been significant changes of late, as Phil's touched on. We're working incredibly intensively now, I think, on governance arrangements, looking at how, because things have changed quite dramatically, I think, in the last few years. We've coming out of the COVID, the impact of things like Brexit on the health and the workforce. There's been significant change. We've got in Newport specifically, we've got an ageing population now that is having an impact, much greater demand on the health services. And I think the relevance of that really is that we use the words, I think, Chair, unprecedented, challenging quite often in social care at the moment, but it genuinely is, I think, a really difficult time for people to be working in partnership, because the challenges and stresses on these agencies are incredibly acute at the moment. And I think, you know, it's a credit really to everybody, our third sector partners, our health partners and ourselves, that, you know, the momentum is still there to actually transform and change the way that we work. And I think that's exactly what's happening at the moment.
Thank you, Jason. Okay, thank you. That was really interesting. And having had a read through much of the report and all of the summary, I think, you know, the work of the regional group is commendable, and the ambition is as well. But we'll take questions from each member, so I'll go around each member individually, and we'll go from there. Okay, Councillor Druitt, we'll start with you. Have you got any questions or anything you'd like to ask?
Yes, Chair, thanks. And thanks, Phil and Sally and Jason, for presenting the report this morning. My question really is about transformational working, and the Regional Partnership Board is trying to coordinate the activities of a large number of organisations. Is the Regional Partnership Board too complex, or is it successful in transformation? What I'm trying to ask really is, what difference is Regional Partnership Board making?
It's a really good question, Councillor Druitt. So, I mean, you'll have seen from the papers that sitting underneath the Regional Partnership Board, we have a number of groups that focus on different areas of work. So we have the Children and Families Board, we have Mental Health and Learning Disability, we have GASP, which is the Adult Services. So we have those boards that then take forward the work in order to ensure that transformation can be sustained. I think if you were to ask the RPB members, I suspect Councillor Hughes would say the same, is that for those of us within that strategic big meeting of the RPB, it's sometimes quite difficult to see the wood for the trees. I think where you kind of see how that does work is in those groups that sit underneath that main RPB structure to really drive operational transformational change. I think as with all of these things, it's quite easy to become quite jaded and cynical, really. And she says, as somebody, you know, in the latter days of her career, too many meetings, too many strategic partnerships. But what I do think we have across Gwent and coming out of the RPB is really good interworking and good relationships between the 5 local authorities, the Health Board and the third sector. And we wouldn't have that without the RPB. It gives us a structure for those relationships, which then gives us a foundation for transformation, which I do think is really important. And it gives us a way to explore ideas and to ensure that there is challenge between us. Do we always get it right? Is it always okay? No, of course it isn't. And I think that there are still huge areas of learning for us in how we drive things forward. And I suppose one of the things that we have to constantly look at is to ensure that we are doing that. We are challenging ourselves, and then we are looking for further transformation and change. But I do think that the RPB does give us some of the structure to be able to do that on a regional footprint, which is really very important given the quantum of issues that we face. And obviously the Health Board is across all 5 local authorities, and there is something much stronger about the 5 of us working together with the Health Board than each one of us working separately with them. I do think that gives us real strength. Does it make a difference? Yes, I think it does. I think there are some really clear and easy areas where you can see difference. I think you can see those, for example, in some of the capital developments that we've seen regionally, which are really impressive. Newport has benefited from a number of those. But I think also in terms of some of the models of care, for example, Home First at the front door of the hospital, community connectors, some of the work that we've done around safer accommodation for children and educare services, and looking at ensuring that children across the 5 local authorities have a consistency of offer from Edge of Care. So I think there's some really strong examples that you can look at where we've worked together in a way to transform and innovate services.
Thank you.
Thank you.
Thank you, Sally.
Councillor Pym, do you have any questions or any lines of inquiry?
Hi, Chair. Yeah, I do. I've attempted to read this report twice. Most of it's double Dutch to me. I find it really difficult to read. It reminds me of a massive bowl of pasta and some sauce mixed in there somewhere. I've been picking away at the pieces. Could Jason, Sally or Phil briefly explain to me what this report is about. So what were the aims and objectives? What have you achieved? And what do you still need to achieve? Because for me, it's just page after page of repetition of charts and things that look copied and pasted from other reports. It simply lacks definition and clarity. Now, maybe that might be me, that I just don't understand this this discipline or this service very well, but it's just repetition after repetition of wording that seem to run most of the time. Yes, so could you just please give a brief outlay of what the report is about, what you are attempting to achieve as a partnership, and what you've got planned for the future, and then I'll come back with a few questions.
Councillor Pym, apologies, before Steve, Sally, and sorry, Phil, Sally, and Jason come back. I just wanted to check that you received the summary of the document that was on page 6 and 7, which kind of compressed everything so that you know, didn't need to digest the full 200. I just want to check that you received that. Okay.
No, I've not read it. No.
No. Okay, because that was in the cover document. So anyway, yes. Sorry, over to you, Sally, Jason, and Phil.
6 and 7, yes, that's the Wellbeing of Future Generation Act. Is that?
No. Page 6 and 7 of agenda item 3 on the documents that were sent out. There's just a cover report that summarises the following 100 and odd pages.
So scrutiny.
It's okay. It's fine. It's not a problem.
It's page 7. I haven't got page 6.
You've got a full summary of the regional area plan.
Well, I'll just go with this thing quickly. But yeah, if you're
it's
able.
It's okay. There's no problem at all.
Is it okay?
Phil, that would be wonderful. Yes.
Yeah. The Social Services and Wellbeing Act was an amalgamation of 76 different pieces of social care and health act, all, as councillors described, dropped into one place. So the area plan and the annual report very much reflects the approach by Welsh Government of putting everything in one place. There's a huge number of areas to cover, and as you will see within the sort of area plan, there's the elements around older people, care, unpaid carers, mental health, learning disabilities, children with disabilities, sensory, voucher, SV. The list is very large. So in a way, as Sally mentioned at the beginning of the meeting, the template we have is prescribed to us by Welsh Government, because Welsh Government will set out in legislation, this is what we expect for unpaid carers, and we would expect the RPB to set out through the area plan the actions for unpaid carers, young carers. Next chapter, mental health, learning disabilities. So by its very nature, it is a very large document because it has to cover a large number of priority areas in the sort of Social Services and Wellbeing Act. As Sally's also mentioned, we have a sub-partnership structure underneath to sort of issue of focus. So for instance, the children's agenda, we have a children and families board, for the dementia agenda, and there's a huge amount of legislation coming through around the national dementia standards, ensuring consistency right across Wales. That all falls at the doorstep of the RPB in the first instance to work out what we can do in regional. So it probably wouldn't be our first choice of ways of working, but ultimately it is set out in statute. It's a statutory sort of duties placed on LAs to work in this way. But just to provide some reassurance, even though that it's a huge agenda, we have those processes, structures in place to ensure that the focus is on the right place, and those agendas have the appropriate amount of time, resources and partnership sort of officers coming together to discuss it. And recently we've developed an autism and neurodevelopment regional subgroup that is with parents of children with autism to ensure the focus there. Within the RPB, we were the first RPB to keep a focus on housing. We didn't have to establish a housing partnership, but given that housing is integral to everything, you know, we have taken on board that and set up additional partnerships. So yeah, sorry to maybe go on slightly longer than anticipated, but just to say it is a statutory duty on us that we have to report in this way, because there's a lot across health and social care, a lot of priorities that require focus.
Thank you, Phil. Sally or Jason, did you want to add anything?
Just to add, really, that there's exactly what Phil's saying. There's no getting away from the fact that it is a really complex agenda. I think it's also one of the things that we're looking at through governance, because even though this is one report, you can imagine the amount of reports that come through to the RPB itself. And I think part of that governance is how we develop and improve the way that those reports get to RPB, so that we can make sort of strong decisions. Really, the focus of that, I guess, will be on the accountability of the RPB and its ability to focus on outcomes. And I think it is a significant piece of work, as I mentioned earlier. And I think it acknowledges, I think, that the fact that the sector is growing at an unbelievable pace. The legislative side is intense. Lots of really exciting, in some ways, legislative changes from Welsh government, but that needs to be translated into sort of delivery, and I think that's the sort of model. But yeah, there's no getting away from it, really, Chair. It is a very complex area. It is
lots to cover. Thank you very much.
I suppose, Chair, I mean, just going back to Councillor Pym's, just trying to do it in 2 sentences in a way, or maybe 3, is that the RPB has to deliver to meet the care and support needs of the citizens of the Gwent footprint, and care and support is defined within the Social Services and Wellbeing Act. And so the RPB has to ensure that the 5 local authorities, the Health Board, third sector, work together to deliver effective care and support. And on the surface, that's quite simple. But of course, going back, I mean, Phil and Jason have already outlined, is that within that are multiple areas that we have to work on. So just to give one really small example, we have to ensure that we are delivering consistent and innovative services for unpaid carers. But that is a tiny part of this whole agenda. So each bit of this has got its own complexity to go back into that larger element to deliver care and support for citizens. And I do apologise to Councillor Pym, because I do agree. I do think there is a complexity about this, which is just mind-boggling at times, frankly.
Thank you very much. Thank you. Councillor Pym, do you have any other questions?
Yes, I do. That's okay, Chair.
Yeah.
Again, from reading through the report, there doesn't seem to be much mention of partnership work with leisure trusts. There's very little mention of physical recreation and leisure within the report. Given the importance of being out in fresh air, exercising for all different ages, needs and specialist responses, do you think it's a little bit light, or has it been missed out, or have I just missed it? That there doesn't seem to be much partnership work with sport, leisure and recreation bodies, departments and trusts.
Who would like to answer that one? Sally?
I can come in on that. I suppose I can reassure Councillor Pym that there is joint work with leisure and with those aspects of the work that then takes place across the council areas. I suppose what I would say is that a lot of the work in this area is very much about that kind of very specific needs of individuals. So it's higher. It's not higher level, but it's about personal care for people. It's about people who are particularly vulnerable. It's not about universal provision and general needs. So there would be, I suppose, something very much which is about an expectation that universal provision would continue to meet those needs in terms of leisure activities and well-being. But just to give you a really good example in relation to children's some of the work within the RPB, there is a great deal of work that is currently going on to look at the leisure activities of disabled children, for example, and how to ensure that their needs are fully met in all leisure provision across the 5 local authority areas and the Health Board footprint. So that work does go on. Could it be stronger? Yes, it probably could be stronger, but it comes back to that enormity of what's going on and the need to kind of pull as much as you can in without losing the core to deliver those specialist services.
Thank you. Phil or Jason, do you want to add anything?
Could I come in? I'll give Jason opportunity, but
Sure.
Do you want me to go first, Phil? Or?
yeah, I don't mind, Jason. I do apologise. I can't see if people's hands are raised. And
No,
I'm not
I
sure
can't see you either. Sorry, Jace.
and I'm not sure if I'm raising my hands appropriately. I'm clicking on a button, but I'm not sure if I have that function in today's meeting. So I'll just wave my hand and
it's fine. I'll just come to people and ask them anyway. Phil.
I think leisure check. It sort of it gives you an example of how complex things are. Really, I think if you're just looking at leisure as a single issue. So if you're looking at leisure to work properly, then you might have a referral from a GP to some sort of to do some sort of leisure activity to improve cardiovascular or something. But that would involve then, if you're living in a rural area, how do you get those people to the leisure centres? It's the same in cities. They could be further out from the centre. So then you've got to work with transport, then you've got to work with different agencies then about getting that to work. Then you've got to work with Newport Live as you do in Newport. So we've got good links into Newport Live, as you know. And that's the whole point. Without that partnership arrangement, a very basic thing like a GP referral to leisure wouldn't actually work very well, because you've got to get all those separate components, including transport, working together. So it's an example really of how complex those partnerships need to be to get something to work really well.
Yes, sure. Thank you, Jason. I understand. Phil?
Yeah, just to highlight, I think this is an area where we work closely with the Public Service Board. I think it's alluded within the report, but our needs assessment was written in conjunction with the PSB leads, and actually the area plan that is in front of you today will be scrutinised and referenced with the wellbeing plan that's required under the Wellbeing of Future Generations Act, because there is a lot of crossover. And I think what's important for us as an RPB is that we don't duplicate efforts as well in the PSB, and vice versa. When developing this area plan, I made sure to work with the PSB colleagues and say, look, when mental health, learning disabilities, unpaid carers is coming up as a need within the wellbeing plan, you know, it's an opportunity for us to work with us on the RPB side to signpost, because you wouldn't want the PSB to set up a whole new arrangement around unpaid carers if there's a statutory duty on the RPB side to take that forward. So there is some crossover. I definitely think it would benefit from some greater links, or maybe just setting out where those explicit links is. Sally has mentioned a few, but also just mentioned under the Act, there is a Section 16 duty to establish social enterprises, and there are a few that have been set up with third sector colleagues, but there's one that's been set up in Torvine that comes to mind called In Our Nature, which is very much about using the environment, walking groups, and that's for people with who've experienced mental health issues, autism as well. So there is that duty, but we will continue to work closely with our PSB colleagues to ensure the leisure trusts are included, but and also at the integrated service board and the GP level with the exercise referrals. So it is there. Maybe something for me to take away today is to make it more explicit, picking up on Councillor Pym's comment.
Fabulous, thank you. And we do know, for example, colleagues, that Newport Live, when we met with them, scrutinised their report, they talked about doing something similar out in nature in each ward and organising walks, which I guess it all ties in. That's great, thank you. Councillor Pym, do you have any other questions?
Not for the time being, no, Chair.
Thank you very much. Okay, Councillor Screen.
Yeah, thank you, Chair. Just to reiterate, Councillor Pym said, you know, and I understand the reason for it. It's a very complex, you know, a very wordy report, you know, and I understand why that is. You know, you've got 5 areas involved. But the question really is about collaboration, partnership. How do you ensure? I've got this area board now. What advantages does Newport get from that? You know, I can't quite, you know, I can understand why it's set up like that, but what are the specific advantages then that come down to Newport, and how do you avoid competition between resources? You know, I think in terms of recruitment, retention of staff in the care sector, for example, which is a big problem. How do you avoid competition between the different local authorities competing for staff, for example? So I just wanted some clarification about the specific advantages that Newport get from this type of working. Is that okay?
Yeah, that's absolutely fine. So a couple of things. I mean, we don't have a choice in this. We can't opt out of this. This is a statutory framework. So even if we couldn't see any benefits, we have to do this. That's the first thing. However, I think there are some very immediate benefits that we get from the Regional Partnership Board, and putting it crudely, one of them is that we have access to the Regional Integration Fund, which is a fund of some 27 million, which goes into supporting social care and health across the Gwent arena. And I think it's really important for us to ensure that for Newport, that we are able to access the Regional Integration Fund to benefit our services. If you look at the budget setting position that we're currently in, the RIF is complicated, the financial arrangements for RIF are complicated, but being able to access that fund and use that fund effectively for the benefit of the citizens of Newport, in the same way as Caerphilly, Blaenau, Monmouthshire and Torfaen are able to do so, is hugely important in terms of improving the services and improving and being able to develop our services. So that's the first thing. I think the second thing is that one of the things that is quite easy to forget within social care is that very often we are looking at relatively small groups of people with very specialist needs. So, for example, if you look at children with very complex disability, we might only be working with a small number of those children, 5 or 6 children with a particular need. And in order to develop specialist services, we are going to be able to develop better services if we're able to look at a pooled provision across the footprint of the 5 local authority areas working with health, for example. That gives us a strength and a capacity. I think in relation to recruitment and retention, it's a really good point and a really interesting question, actually. I suppose the first thing is that I think one of the things that working regionally has done is it actually helps us not to work in competition, is there's more of a shared approach to the challenge and recognition that the 5 local authorities have got slightly different needs, as already been touched on, but actually fighting for staff isn't going to serve any purpose. And what's better is to try to find a joint approach, for example, looking at things like developments with Coleg Gwent, looking at how we increase apprenticeships across the area, etc., etc. So it's looking at a joint approach across all of us to meet the needs of the workforce and the citizens. I do think it's something we've got to keep looking at. I mean, I talk about social work recruitment in particular, and I suppose one of the issues we do know is that not across the 5 Gwent authorities, but in some others, they are paying more or they're giving golden HOLOs, and we have to work to try to find a system that's better. I think within the RPB area, we have managed to do that. And the other element that's linked to social care and recruitment in adult social care is also to do with the providers, is that in order to provide domiciliary care and residential care for adults, we work with a very large number of providers across the area, and we all work with the same providers. So again, working together gives a coherence and a strength when working with those providers rather than working individually with them. I think that's just a kind of headline flavour really in terms of what the benefits are, that there's more than that. I suppose the other thing that I would say is that, and I'm going to be careful, but health is a very big organisation. Health is a big, powerful organisation, rightly so. Our well-being depends on health. And I think sometimes from a social care perspective, being able to work together as 5 local authorities with the health board, again, gives us a real power in being able to work sensibly with health rather than all working individually and against each other to do different things. So rather than it being competition and us battling with each other, I think what the RP does is gives us strength in numbers. And I think actually that's hugely important in the current budgetary environment that we're seeing.
Absolutely.
Yeah, thank you, Chair. Thank you, Sally. That's a very clear answer to my question. I think it clarifies a lot of concerns that I had about, competition and collaboration. Yeah, so thank you for that response.
Thank you, Councillor.
Oh, sorry. Councillor Green, do you have anything else you'd like to add or ask?
No, that's fine. Thank you, Chair. That's fine.
Thank you very much. Okay, Councillor Davis, is there anything you'd like to ask about or any lines of inquiry you'd like to pursue?
Not at the moment, Emma, that's okay.
No worries. Oh, Bev, you don't sound very well. Okay. And Councillor Hussain, is there anything from you?
Oh, thank you. Thank you, Chair. Like the other members have mentioned, that it is a fully packed report, and thanks to Neil for the summary, which was very helpful. I wanted to actually ask, I mean, Sally has mentioned about funding. Obviously, you know, that's probably one of the challenges going forward. But I just wanted to know what other, you know, challenges does RPB anticipate, and how, you know, addressing this going forward, and how will they be addressing these challenges? It might have maybe with the partners, maybe just, you know, with delivering the area plan.
Gosh, that's not a small question, is it? That's almost as big as the paperwork that's been submitted. I think that obviously the budget position is particularly challenging, and the Regional Integration Fund, we are just on the edge of another round of discussions about what is a planned taper in that funding, which we are really clear that our RPB chair will need to push back very strongly that the 5 local authorities and the Health Board are not in a position to tolerate a taper to the funding. So I think that the funding is one element of it. I do think, I mean, Councillor Screen touched on it. I think workforce is a huge issue across the whole of the RPB footprint and for all of the agencies within it. There is a great deal of work going on in the workforce area to look at how we can develop further training, how we can ensure that young people are interested in a future career in social care and in health, and then how we can support them to do that, and then also how we can retain our staff, so that how we as the partners can ensure that our staff want to stay in social care and health. You know, people are tired, and people have faced a very long 4 years in social care and health. And I think how we support that group of staff is ever challenging. And I don't have an easy answer to that, Councillor Hussain. I think that, you know, frankly, if I'd cracked the recruitment retention, I'd be off being a millionaire consultant somewhere in England. So I haven't cracked it. I wish I had. I think what we have to do is continually look at how we support our staff, because actually what we find is that support is key. Support, morale, ensuring that they want to work with us. But that is a challenge for the RPB and is going to continue to be so. I mean, obviously, we in Newport, we very much living wage city, and looking at how that impacts on social care. Social care from a Welsh Government perspective is very much looking at the salary of social care staff and how that can be enhanced. But it is a real challenge in the current budget environment. And there's also something at us looking at the differences between health and social care and the different career pathways that there are between the two. So I think recruitment retention after the budget would be the #1 biggie for me. I think the other element that I think is a real challenge across all of social care and health is the ongoing fallout from the pandemic and from cost of living crisis, and what that has done in terms of our populations and our staff. And from an RPB perspective, I would certainly say that particularly looking at, for example, mental health, emotional well-being for children and adults, and looking at the fallout of the last 4 years on our populations and what that does to the demand on services. So it's not just recruitment tension, it's not just budget, it's also that the demand has increased for particular reasons. And I think within our adult population, the other thing that really tragically that we've seen is a loss of function for people over the period of the pandemic. And we've seen the fallout in terms of loneliness and the isolation for people. And that is now beginning to fall into what we need to deliver to ensure people have got a good quality of life in their later years. So I think those are the big challenges: budget, recruitment, retention, workforce, but then finally the demands for our population and what we should be providing in order to give them a real sense of strength and well-being for their futures. I think that is possibly, if anything, the biggest of the challenges we face.
Thank you. very long answer to a very complex question.
It's a
as well.
very big question. Yeah.
Yes.
Thank you.
Thank you.
Oh, Phil, yes, sorry, I have seen your hand go up. Yes, Phil.
Just something very quickly to add to Sally's points. In terms of workforce, we are very fortunate that we've set up a consortium arrangement with colleague Gwent and the Regional Partnership Board to look at how we support younger people in college, in universities, and encourage them into health and social care. It's not replicated across Wales, and it is starting to have some positive dividends. We work with some of the staff in Nash College around the health and social care level 2 course to ensure that there's links then with health and social care providers. So it's something that we're really proud of. It's important to get the voice of young people, but it's important to catch some of these people at that younger age as well. There are better rates of pay sometimes in retail, so that's working well. And colleague Gwent have recently introduced this term the first access to medicine course at Crosskeys College, and that is on the back of an excuse me, of the efforts of Dr. Paul Edwards in the Health Board, who would like to see more people moving into health and social care. So it's something we're particularly proud of, and I just wanted to add that point.
Thank you. You've covered like all the aspects actually of what the challenges of delivering the plan. Thank you very much.
Thank you. Just a couple of bits from me. Sorry. I mean, I read most of the report. Well, I definitely read through all the summary, and I read through all the rest of it. And I was particularly impressed by the regional board's ambition to increase the more timely diagnoses of ASD and increase services there. And I really hope that comes to fruition, and especially with all the challenges that we see in the health sector and all that sort of stuff. But something that did catch my eye was the Rapid Rehousing Action Plan. And in the summary, we talk about the non-use of B&B accommodation for young people. And I know in Newport, obviously, we have this wonderful housing, we've been recognised as a leader, and we're doing some really, really great things. But I was just wondering if there's any way I could get some more information about that. I'd be interested to understand how we're going to avoid the use of B&B. And when we say the non-use of B&B accommodation for young people, does that mean families, or does that mean young people who find themselves in 16, 17 up kind of thing?
I think in terms of the RPB element of it, we can come back to you. And then in terms of Newport specific for our 16 to 24-year-old population, we've got a whole wealth of work in this arena. Perfect. Can I suggest that either we can put a written answer to you, or I can arrange for you to meet with the service manager who's working with this area. Either of those would be fine. And there is a lot of work that we're doing in this, some of it funded by RPB capital money, some of it funded by RIF. So I suspect if with a particular interest in that, possibly a separate meeting would be really helpful.
That would be brilliant.
Yeah, we can do that. That's fine.
That would be wonderful. Thank you very much. And just to go back to the tapering, lots of these services that we have aren't nice to haves. They aren't, they are essential to our population. As a committee, would you be happy for us to write to Welsh Government as well and highlight how, we're not in a position to accept any tapering currently?
Yes, we would be really happy for any support from the committee in relation to the tapering. This report will go up into Cabinet. We have Cabinet Chairs briefing today. We had an RPB meeting yesterday, and there is a meeting of the RPB Chairs tomorrow. But from a Newport perspective, I think the emphasis has to be is that if the tapering does come in this year, we will see a very significant reduction of, as you say, not nice to have, but essential services. And thank you. Yes.
Which would be a huge shame, obviously, because we're starting to see the results now. Like, you talk about young people going into care, all this sort of stuff. Lovely.
Definitely.
Okay.
Yes, we would. Thank you.
Neil, are you able
to come in quickly? I think just a push on that, Chair, if you're writing to the Assembly, I think, it's I know it's difficult for Sally to come in on that in some ways, but I think, the implication of risk tapering at this moment in time would be catastrophic. It wouldn't be difficult. I think we just cannot afford to lose some of those services that we've got now at a time when they needed the most. So you know, there's a reality about how significant that move would be. So I hope to get that over.
Thank you, Jason. Phil, did you want to say something?
Just on that point, Sally's already mentioned it. The 7 RPB chairs meet tomorrow, and there's very much the intention to write to the Minister collectively as a national letter to the Minister, just to highlight some of the risks involved with tapering. So we can share that letter as well. So there may have already been a letter sent to the Minister by the time the committee gets around to develop the letter.
That's wonderful. Thank you so much. Okay, if there's nothing else on that particular report.
Yes, Chair. I did have my hand on.
Oh, sorry, Matt, I can't see you off screen.
Yeah, just one thing, it may well be in the report, but I've not read it or must have missed it. There's not much mention of obesity and the issues and concerns linked with obesity. As I'm sure we're all aware, there's an obesity crisis in Wales, in South Wales particularly at the moment, with large numbers of people being considered to be bariatric, which is grossly overweight. Obesity has massive impacts on people's physical and mental well-being. It's associated with poverty, loneliness, poor health, and as a result puts a lot of demand on voluntary carers, usually parents, brothers and sisters, grandparents, to support those people that are struggling with their weight. Is there a specific strategy or partnership work across the board on how to kind of tackle the rises in obesity and bariatrics?
Bill, would you like to start?
Just to highlight, this is an example where we work with the Public Service Board. Yet again, very much a feature within the wellbeing assessment completed by the PSB and the wellbeing plan. We link closely, but I guess for me it's one of those priorities which the PSB is leading on under the public health agenda. We will of course support and complement the approaches, and there will definitely be crossovers and in terms of joint working, and that might be at the neighbourhood care network level. But in very much in the spirit of avoiding duplication, there's definitely priorities that the RPB lead on, as I've mentioned, mental health and carers. On the flip side of that, there'll be PSB priorities that we may be looking at the PSB to lead and us to support. Yeah, that's it. Hopefully explains it. It's why it probably doesn't feature as strongly within the RPB, but there is definitely considerations at local levels of the impacts.
Thank you very much. Okay, are we ready? Thank you, everyone. That was brilliant. Are we ready to move on to the next item, agenda item, which is the annual report of the Gwent Regional Partnership Board? And Sally and Phil, will you be speaking on this one?
I'll start with Phil this time. Yep.
Yeah.
Lovely.
I mean,
thank you, Phil.
Hopefully this is a useful segue into the annual report. What you previously discussed is the statutory area plan that we have to discuss, our action plan detailing outcomes and actions that we hope to achieve across the region. What we have also have to undertake as RPB is an annual report, and that annual report it can be equally complex and large, but we've tried to break it down, and that highlights some of the progress that we've been taking forward in the area plan and wider in terms of strategic partnerships. So hopefully members would have had an opportunity to look at maybe some of the infographics or some of the high level summaries and just get an appreciation for some of the progress that's been made, but also, you know, the annual report will set out some of the challenges as well that we need to take forward over the next year.
Yes, thank you. Sally?
I mean, again, this is a backward look for 22-23, and we've obviously discussed at some length the plan in terms of looking forward. So this is just a reflection really on 22-23. This links to is that my annual Director of Social Services report, which has already been to Council, because there are overlaps between the work that obviously we do within that report and then what comes into the annual report for the Gwent Regional Partnership Board. Okay.
Thank you. And Councillor Hughes, do you have anything you'd like to add?
Very much the same. It's a reflective report, but many of the issues are still, ongoing, as it were. And Sally's talked a lot about some of those issues, such as workforce, and I think those issues will be ongoing. And then, as you'd expect, new priorities will come in the next annual report.
Fabulous, thank you. Okay, we'll go to questions then. Councillor Jurett, any lines of inquiry or any questions?
Yes, thanks, Chair. How will the Regional Partnership Board continue to deliver its strategic priorities in the face of ongoing challenges and uncertainties?
Bill?
I think Sally's mentioned it in the previous agenda items, but it's just that continual investment in partnership and relationship working, developing partnership through relationships. The priorities can only be tackled, I think, in partnership across the 5 local authorities, and the continual investment by Newport and the other local authorities, the third sector providers and the health board, to meet around the table, whether it's around children and families, carers, it is important. It's about maximising the use of the grants that Sally has also set out previously, and ensuring that really there's synergy across all partnerships. A problem shared is problem halved, and what we get the benefit from by working in partnership is good practice. So there's definitely some elements of good practice that have been developed here in Newport that we've been able to share with other local authorities. For instance, the MASH, the multi-agency safeguarding hub that was developed here in Newport, was trialled, it was piloted, and that's now happening in each of the other local authorities. But then there's other elements such as my service team that were developed in Torvine and Caerphilly that Newport's been able to learn. I think Sally's also mentioned to that as well. So yeah, partnership, relationships, good practice.
Phil, what about the taper? Is that going to be a challenge for you?
Yes, definitely the tapering, and going back to the point and the very helpful support from yourselves as a committee to make representation to the minister if needs be, to help reduce that. But yes, that would be, I think we've got that support from yourselves in terms of that tapering, and yeah, it goes without saying.
Thank you. Sally, would you like to come in?
I think I'd reiterate, really, it comes back to, I think there are some really good examples of what we've been able to do regionally and learn from each other, and we'll continue to do so. But I think the threat of what might happen in terms of the taper, and I understand the principles behind the taper and why that the minister is interested in that as a model, and I get that in times of honey and plenty, but unfortunately we're not in those times, and for me that then undermines. So I think that if we want to continue to be able to really work together and look at good examples, we have to continue to analyse our spend within the RIF and ensure it is good spend, and I think that's a piece of work that we are constantly doing, is looking at, is this a good spend of the money that we have within the RIF? And I think we also have to really kind of ensure that the spend within the capital portfolio is wise and is aligned to the other capital budgets that we have across the region. And we've done a great deal of work to try to ensure that's the case. So, yeah, I think there are real challenges ahead. I suppose I would hope what we have is a strong enough foundation in the partnership working, so certainly at a strategic level, and then at an operational level to be able to mitigate some of those challenges.
Thank you very much. Thank you. Jason, is there anything you'd like to add?
It's just a highlight, I guess, Chair, that despite all these challenges, what I'm seeing certainly across the region is that Wales is continuing to be very innovative and transformational still.
Absolutely.
I think that's a real credit to the staff that we've got on the ground, and the agencies that are working to help, especially who are under immense pressure, as we know, social care staff. And I think, for me, certainly as part of my work in Regional Partnership Board, is that the governance, the changes to governance now for us is critical in the sense that it'll allow us to streamline, to actually look, because the agenda is so huge, it'll allow us to focus really on what our objectives are, and actually, you know, get a better understanding. As you can imagine from your report today, our reports are incredibly detailed. They come in, you know, one after another, and we need to get to a better way of being able to dismantle that information down and actually have really good outcomes from it. I think going back to what everybody said, really, we couldn't do it now, to be honest, without partnership. I think that's the situation we're in. So, okay. You know, we have to pool resources, we have to work together. And what it does give us is the opportunity sometimes to pilot things, where instead of 5 regional authorities all doing their own thing, we can experiment, we can be innovative, we can still try little things, see how it works. And if it works well, we can push it out then, firstly across regional partnership and then throughout Wales. So I think you know, there's a lot of innovation, I think, as well, that comes from that partnership working. That's really important to sort of highlight as well.
Lovely, thank you very much. Is that okay, Councillor Joe? Is there anything else you'd like to ask?
Thanks, very full answers, thank you.
Thank you very much. Councillor Pym, do you have anything?
No, not at the moment. Cheers.
No worries, thank you very much. Okay, Councillor Screen.
Okay, thank you, Chair. Councillor Druitt has actually mentioned part of the question I was going to ask, but going back to the challenges, I mean, from my perspective, I can see an ageing population as being the biggest challenge facing us. I saw some figures the other week that something like by 2030, 45% of the population will be supported by the rest, and that figure is going to increase. You look at some countries like Japan, for example, South Korea and so on, they've got, you know, increasingly growing elderly population. And then with age, as I can, you know, my own experience with age, you get all sorts of things happening to you, you know, so it's a great thing that we're living longer, you know, it's really great thing. And increases in medical technology, you know, helping us. But again, you know, it seems to me that you know, social care provision, you know, is sadly lacking, you know, nationally, not just in Wales, but nationally. So what is, I mean, how do you see that particular challenge facing you, and you know, what the advantages then of working in a collaborative manner could help sort of alleviate those pressures? I'm sorry, this is a question.
No, this is a morning of big questions, isn't it? I mean,
yes, I'm sorry.
Yeah, no, absolutely. I mean, you know, it's really good to air them, I think, and to be able to air them in this way is actually really helpful. So thank you, Councillor Screen. I think that, I mean, that the national social care position is, you know, if I put a non-professional hat on, it's terrifying. I mean, that's the reality, is that you're right, is we have an ageing population. We have we also have a challenge in terms of the number of healthy years that we live. I mean, I'm sure those who are involved with the PSB will be aware that of some of the work that has been done under the Building a Fairer Gwent for the Marmot report, and looking, it's not just at life expectancy, it's about healthy life expectancy, which is so important in this area, and looking at how many years before the vagaries of age start to weigh in on us, and we do need help and support. And I saw some information which suggested that in Australia, for example, they will reach a point where their entire under 60 population will need to be employed supporting their over 60 population, which quite frankly is clearly untenable. Wow. And I guess that mirrors Japan and South Korea. And I think what we nationally need to do is really understand what it is we want from social care, what we expect from social care, and then how we're going to fund it. Because the reality is that good quality adult and children's social care cannot be done on the cheap, in my view. It is something we should be investing in. And if you look at Newport in particular, if you look at the data from the census, we're in something of a sandwich in Newport, in that we've got an increasing over 65s population at the same time as we're one of the very few areas in Wales where we've got an increasing under 25s population. And that brings with it another set of challenges in terms of education and opportunity for that group of our citizens. So we're in a really odd position in Newport, in that we've got both ends of the spectrum coming at us at the same time. I mean, I have very strong personal views on how social care should be resolved long term. They're probably for a pint in a pub rather than a scrutiny committee. But I think that the challenges in terms of how we work together are key. So I think, I mean, Councillor Hughes has already touched on, I think we have a better chance of being able to address some of those challenges if we work with each other than if we try to work in isolation. So if we work just with the population of Newport of 170,000, as opposed to working with the footfall of the whole of Gwent and what that might mean, it's a very different set of solutions. So I think that for me, if anything, just heightens the need for partnership working. And I think picking up on your point about medical care and everything that goes with it, the need to work with colleagues in health to get this right is absolutely key. And then I suppose there's a further element, which is how we work to protect our own health. I mean, I think Councillor Pym's point about obesity strategies, but it's bigger than that, isn't it? It's also about our general health and how we look after ourselves and what we expect from services. There's a report today out which the increase in the number of people going into A&E for hiccups and nasal congestion. Now, there is something for all of us as a society about how we tackle those issues to ensure that we can improve our own health going into old age, that of our families, and then our expectations of services to better be able to meet the needs that do need meeting. I don't think that's a great answer, Councillor Screen. I think that's almost an invitation for another discussion about how do you solve social care. And when we've cracked that, we can all go off into the sunset and go to our residential homes. And I know, I mean, Councillor Hughes has highlighted different ways of doing things that he's seen in different countries where you look at different ways that communities live, how they support each other, whether or not those are things that we nationally need to have a conversation about, or whether they are things in Newport we might want to pilot and think about, and are there ways that we could do that? I think we're more likely to be able to do that with a regional support than we are without it.
Okay, yeah, thank you, Sally. That was, yeah, I know it's a big picture, isn't it? It's all the big picture.
Huge.
And you know what the answer, I mean, I think I know what the answer is, but you know, it's probably not very popular in terms of, you know, we're going to have to pay for social care. You know, it's going to cost money, isn't it? It's got to come from somewhere. But I think the good point you made there about looking at other countries and what they're doing in terms of dealing with, you know, an international global issue in the developed countries. I think that's a very good point, you know, and something perhaps the Regional Partnership Board can look at in more detail. You know, what lesson can we learn and what can we apply to Gwent and to Newport? Yeah, thanks very much, Sally, for that. Sorry for the big picture.
I think it sounds like we need a day's workshop just to talk about social care and what views are and what we could explore. Yeah. That's what we're getting to, I suspect.
Indeed.
Absolutely, and just to add to that, our domiciliary social care workers, you know, they're phenomenal people. They, you know, some of them, my mum's one, so there we go, declaring a bit of an interest there, but you know, she administers syringe drivers if people need it, or you know, the level of responsibility and the level of work our domiciliary social care workers have, and in Wales it is innovative. They are paid the living wage, but yeah, their skills and how much we need them, they should be infinitely more money and infinitely well looked after.
Yeah, I'm on the other side of that equation because my mum receives domiciliary care, has done so recently, and I mean, you know, looking at the level of skill they have to go from one call to another, all in different houses, different needs, different environments, huge levels of understanding of each of those individuals' needs, very often on their own, or at most just two of them on a call. So it's not like they're in a setting where there's lots of people they can call on. They're on their own in those settings. Yeah. And you know, I think, again, it's a personal view, but paying them a living wage is one thing. But frankly, given what they do, it doesn't get close to what they should be rewarded in terms of what they then contribute to ensuring people's safety, independence and well-being. And I think that the general population's understanding of what domiciliary care means is just so out of kilter with what the reality of what domiciliary care is in somebody's household. You know, the days of going in for making a cup of tea and a general chat are long gone, sadly. It is a really skilled specialist job which requires a level of warmth and empathy which most of the population don't get close to. So I think it is hugely important that we recognise that.
Yes, and obviously the crisis, you know, again, not touching on anything personal, but I know my mother and lots of her colleagues, my mother's 69 and she's still working full time because she feels she can't give up, because, you know, and we really need to nurture, as we are doing through the area plan, more young people into the service, because it is a skill to, and start looking at it in the same way that we look at nurses and things like that, because, yeah, sorry. I feel very passionately about carers. This is definitely a conversation over a pint job. Okay, sorry, Councillor Screen. Anything else, Councillor Screen?
No, I mean, you know, I think we all agree, you know, that, you know, the elephant in the room is becoming bigger and bigger, really, in terms of social care. And I think we need to avoid intergenerational conflict. You know, those who are going to have to pay the taxes, you know, to keep the rest of us, you know, going. You know, I think we got to say, well, look, you know, one day you will be in that position, you know, hopefully, you know. And I think I think it's something we ought to focus on. I don't know, perhaps the regional partnership have a day discussing, you know, social care, really, because it's seemed to be swept under the carpet a lot. You know, people know it's there, but they're refusing to. They're just walking past it, you know. But there we are. Thanks very much.
No worries. Councillor Hughes, did you want to add anything to that? I saw your hand was up before I started going on.
I was just saying it's difficult for people to realise the scale of the problem, really. But, you know, Councillor Screen's touched on it in the sense that when we throw figures at people, 10%, 20%, it means very little. But what it actually really means in Newport is that, you know, by the time we get into the 2030s, we'll have a population of between 35 and 40,000 people in the city who will be over 65. So, and that it's not just about the over 65s. Our over 85 population is increasing as well. And I think, you know, the priority for us as maybe as a nation, not just a city, is not to look at. I think the fact that we've got older people living longer is a reflection of how in some ways, how successful our health and social care systems are, and but people have to start thinking much earlier than when they get to 65 about their habits, about how they live, so that by the time they get to 65 and onwards, they're not just living longer, they're living healthier and better. Yes. And I think that's the way we'll probably practice. Not in the end, it's about getting as many people into their 60s and 70s already relatively healthy, and they don't fall off a cliff when they get to 65 and things go really bad for them. So I think, you know, and that's part of the RPB work, really, and the work of the councils to do preventative work at the beginning, and to, you know, education in schools, education through lifelong living, all the getting people active as long as possible, as early as possible, and staying with that. And that ties into a lot of the policies you see coming out of government in Wales, really, around how do we get people more active, how do we get people cycling, how do we get people walking more. You know, it's all part of that agenda, not just living longer, but living healthier, I think.
Yes. And not just get them, keep them walking, cycling, etc. Yeah, fabulous, thank you. Okay, Councillor Hussain, have you got anything?
Yes, I have. And just like, you know, all members have been saying, this is a vital service, and, you know, it needs to be going as long as it can. But my question was that, well, what kind of feedback have RPB received from service users and its partners, and how have you responded to the feedback, you know, whether it's positive or negative?
So I'll start, and then I suspect Phil will come in. So there's some layers to this. So obviously, in terms of individual service feedback, so service users who are in receipt of services, there's almost daily feedback in terms of the care that they receive. I do sometimes think that we need to be careful about how we approach that care, because sometimes people are just grateful for anything, and that's not good enough. Our approach to response to care should be more critical than that, rather than just, oh, well, it's better than I was getting before. Well, that's not good enough, and we need to be better at really being more challenging about some of the care that we do and don't get. So there is almost daily feedback in terms of a loop about services, and it is difficult because, I mean, just going back to the previous discussion, just providing enough care in some situations is hugely challenging, basically. And, you know, picking up on Councillor Corton's mum and her caring role, you know, when you've got this many minutes to do this many calls, and then something goes out of kilter, and then you're late for the next person, and then that person is inevitably out of sorts with you. So you're always going to have challenges in this area. And in children's services in particular, that's very, very acute in terms of the dilemma between safety, protection, and then supporting families. So you've always got that tension. So I think in terms of the feedback, it starts there. I think on a strategic level for the RPB, we have on the RPB membership, we have a number of representatives of user organisations, and we also have a citizens panel that also contribute into the work of the RPB. So there is, on a strategic footprint, more contribution in terms of those organisations. I don't know, Phil, if you want to elaborate on some of that.
Yeah, just to say, co-production, design and services support with citizens is a core principle within the Social Services and Wellbeing Act. And as Sally's mentioned, there was an RPB meeting yesterday, and we had a citizen rep and also a carers rep at that meeting, alongside directors, elected members and executive leads within the health board. We try to ensure that that co-production is right across the board. So in terms of our work with young carers, children, older people, people living with dementia, carers, etc. And I mentioned recently that you know, we've just established a new group with parents of children with autism. So it's an attempt to try to work with citizens to develop those solutions, and so that feedback is not just in the form of a survey and then responding to that, but that is continuous. And I guess just to highlight, on Thursday there's a regional event with the housing support leads, where we'll be looking to engage with the service providers, and again give citizens our opportunity to come and comment on their services, what's working well, what's not. But yeah, I think the key focus for me really is co-production. It's not just that survey, you tell us what's wrong and then we'll go away. It's actually being part of that sort of journey with us.
Yeah. There is actually one other question. Yeah, no, my daughter-in-law has also gone back to her a carer's role after maternity leave, and she's noticed that she's had a few patients who you know, who use sign language. Do you actually provide any training for carers who might want to do a British Sign Language course? I mean, is that part of training with the carers and, you know, your staff?
We are doing regionally. We have been rolling out some training for BSL for various organisations and various individuals. So it's not universal. So it's not that everybody gets training in BSL, but there are some who have had training, and there is a programme to look at how we can enhance BSL training across the region.
All right. Well, that's great as well. Thank you.
Thank you, Councillor Hussain. Thank you, Councillor Pym.
Hi, thanks, Chair. Just coming back to Sally Ann's previous points on the Phil and Jason's. As we know, probably more so than previous decades, we've got children growing up in very poor areas, in poor environments, having very poor opportunities, career-wise, job-wise, and that often leads to poor life choices, and they will grow into poor and sickly elderly people more often than not. It's tough at the moment with everything that's going on across the UK. Within South Wales, and we've discussed the importance of partnership with surrounding and neighbouring local authorities. We do have lots of green space. We don't have an awful lot in Newport. It's a very built-up area, but not too far away. There are large areas of green space. We're talking about health and well-being and the importance of exercising and getting out and about. Are there any long-term plans on how we can develop these cycle tracks, these places to walk, as opposed to kind of hoping it's going to happen? Is there a strategy? Is there a plan in place on how we can develop areas within the whole of our partnership that people could visit, people could be taken away from the environments where the problems continuous, even if it's for a day, if it's for a week? It doesn't have to be necessarily a long-term issue, but I think a lot of these problems that we talk about with social care is the environment that they're stuck in continuously, that sinkhole that they can't escape from. And it wouldn't cost an awful lot of money if we started developing some green spaces that people could visit in neighbouring local authorities, because they're blessed with an awful lot of green space and a nicer environment than what we experience in Newport at the moment, because it's such a built area.
Before we come in on that, I think lots of this is covered by One Newport, isn't it? They create lots of these types of spaces for well-being. So that might be part of your answer, Councillor Pym. And obviously One Newport joined us last week, but Sally and Phil and Jason, take it away.
That would be part of my new.
Sorry, go on. So just come back quickly and just say, although I appreciate that we're a very urban city in that sense, it's not to take away from the fact as well that we do actually have quite a lot of green space within the city. Absolutely. And I think, we've got some world-class parks, parks that are acknowledged as being incredibly important green space areas. We've got Juridico Park, Fairview. We've got really, really, really good green spaces within the city. That's not to say that there's areas of Newport that aren't, but I think it's just important to acknowledge that we do have really, really important green spaces.
But Jason, when was the last time we developed a green space in Newport?
It's continuous, it's ongoing. And if you look at organisations as well, coming back to what you're saying about, we've got organisations like Growing Spaces and stuff in Newport that do actually do exactly that. They actually encourage people with mental health issues to go out and work in the outdoors. And I think there's lots of agencies that do that. Some really good work going on in St Cadix, in St Cadix as well, with the workshop that's going on there.
The Veterans Hub have an amazing facility.
Grange has got its own garden there now as well, which is linked directly to health. So there's lots of really, really good work going on. Maybe the issue is how do we get that information out to members about exactly what they've got on their doorstep.
And I think from the committee's perspective as well, it's looking at green spaces, not just in the traditional senses of parks, isn't it? It's looking at our woodlands, it's looking at our allotment projects and other things that are going on. But Sally and Phil, you definitely will know more on this. So Sally, do you want to lead on, take the next?
Yeah, very, very much in terms of this is really very much within the arena of One Newport and also other areas within the council in terms of how we develop green space. I mean, much as I'd love to develop that within social services, I think it's probably beyond my remit, and that's not to go like that, but it is also recognising that this is a huge area and that development and promotion of green space does sit elsewhere within the local authority and then regionally in terms of development. But having said that, I would say that within lots of the projects and lots of the work that's done under the auspices of the RPB and then within local authority social services, I mean, Phil's already touched on an example of a project within Torvine. We've seen really good examples of walking projects which encourage people to get out and about. And within children's services, we have lots and lots of examples of really encouraging how to support families and accompany them, be that to the park. And I would agree with Councillor Hughes. We have some fab parks, so it's ensuring that we have proper use of those parks as well as wider green space. And certainly, for example, Phil mentioned projects like Mist or some of our residential homes that we've developed with RPB Capital. Windmill Farm couldn't be more green in terms of where it is, in terms of green space development and a real environment for children that really does bring nature to the fore of some of encompassing their care. So I think it is very much there as part of our agenda and what we're looking at. I think that wider agenda that Councillor Pym is talking about in terms of increasing cycle access, increasing access to green spaces, I think we can certainly come back to you with other areas in the council who are working on that. It's probably one of the few things that doesn't fall directly within the RPB remit, basically.
Yes, and I think, you know, the reports we've seen from Newport Live and One Newport in recent meetings cover a lot of that. Phil?
I guess just to add one other small point, exercise referral schemes with GPs is very much around using the natural environment to help you know, promote and support people's well-being. And we've also recently piloted a microcare scheme, which is very much around befriending and helping people to access their own community. And these are people that may have had day opportunities elsewhere. So definitely, I think uncontested is the maximisation of our green spaces in promoting health and well-being. And there's elements of that right across some of the RPB programmes.
Thank you very much. Okay, so Pym, is there anything you'd like to add?
No, that's it, thanks.
Wonderful, thank you very much. From my perspective, and I'm not going to go too deep, don't worry, I just wanted to say we've talked about our domiciliary care workers, but we should also mention the great work done by our unpaid carers, especially our young carers, some of whom I've had the privilege to meet, and they're just incredible. And it's great to see the work that's going into supporting those guys to being able to do what they can do, because especially, you know, our young carers, the burden, the pressure on those young people is just phenomenal, and they're all incredible, often with their own complex needs as well to contend with. So I was interested to see that some of the Welsh Government grant funding was used to provide services for over 19,000 unpaid carers, but only just over 2,000 of those reported feeling less isolated. So and I know that's difficult, and I know you're looking at a wide demographic of people, all with their own different needs and interests. But I wondered if I'd be quite interested in exploring that to see how we can improve that uptake, and you know, get more positive feedback. You know, I'd just be interested in more information on that if possible.
No, I mean, I think it is a really important area. It's how do you get over that bridge in terms of consistently breaking down that isolation and loneliness. I mean, within Newport, we've got some really proactive work linked to carers and linked to the Chatty Cafe and how we ensure that we work with our carers, our unpaid carers. But I do think it's a constant area where you can't just do one thing. You've got to keep doing things. You've got to keep bringing people in. Being a carer is really hard, be it young or old. Absolutely. And you're not just going to do it like that and fix it. You've got to continue to work with people. And something like Chatty Cafe, for example, works really well for some, but not for others. So it's how do we broaden the swathe of what the offer is as well, to ensure that you capture those people who perhaps aren't ready for Chatty Cafe, or it's not their thing, or just aren't able to get there. So no, I agree with you. I think it is an area that we have to keep working at, basically, really hard.
Yes, if we didn't have our unpaid carers, we'd be in even more of a crisis at this point. And that's all I wanted to add to that, really. Phil or Jason, did you want to add anything to? No. Okay, that's great. If no, oh, sorry, Pat. Yes, Councillor Druitt.
Can I just make a comment on the case study, Crick Road, the dementia project, and that is a really innovative project, it seems to me, and I just wonder whether that is going to be modelled elsewhere.
Yeah, we can take that back to the housing partnership, who oversee the capital developments, and look to have received the latest update. But as I mentioned previously, one of the benefits of the partnership is good practice, learning from other areas, especially where we know outcomes are being achieved. But I'll take that question back, and the capital projects will need to come back to the RPB, so we can keep an eye on that with I'll mention to Sally and Councillor Hughes to see if it does come up.
Thank you.
Thank you, everyone. Okay, I think that's it. I think we've scrutinised the reports. Thank you very much, Sally, Phil, Jason. Thank you for just being so informative and so knowledgeable and not being afraid by the big questions. I really appreciate it. Thank you so much.
Thank you, Chair. Thanks,
Thank
members.
you for your time.
Thank you.
Thank you.
I'll leave. Thank you very much.
Thank you.
Thank you.
Yes, thank you.
Thank you.
Right, we'll just wait for Councillor Hughes.
Jason.
Everybody. Cheers, Jason.
Thanks.
Thank you.
How did everybody? Thanks.
Okay, Councillor Davis has left us to go to work. So we've got Councillor Screen, Councillor Hussain, Councillor Jurett and Councillor Pym. So the next item on the agenda is the conclusion of the committee report. We need to formalise our conclusions, recommendations and comments and items for action in. Neil, over to you.
Some of the comments I've taken, the report was considered to be a complex document, although Phil and Sally did advise that it is a statutory duty on us that they have to report this way, but I can certainly...
Going to be a limit on the content of wording. I know I'm kind of coming across as a little bit needy, but it just seems that you're scanning through and it's so much repetition and so many acronyms and buzzwording. It's not just, it's not just this report. And I did actually read the summary. I did before. I didn't realise that was on yourself.
Yeah, so that's handy because I don't think any of us could have got through every word of the 200.
No, and I didn't. It's a massive help, and if they're available for all reports, I just find when writing these reports, they all seem to be similar structure, similar content, and they're a bit like your kids' school reports, whereby someone's just cut it and pasted the bulk of it, and that's just generic information. Whilst and the important stuff then gets lost in there. I think whether you would limit the amount of words or, as you just said, 2,000 word report, unless you can really justify going over it.
I think I understand what you're saying, and I take that on board, Matt. The problem is,
more helpful for us to be.
Sorry, can I just finish? Sorry. This is a statutory report, and there are certain things that they have to share with us legally. So whilst we can take that and feed that back, I don't know in terms of the level of content in this particular report what they'll be able to take out, because they have obviously the legal obligation to report all this stuff back to us. And I refer back to that summary, Neil, that you did, which was incredibly handy and really focused the mind. But yeah, I think let's take that point back and let's see where that goes.
Sure thing. Thanks, Chair. We've got comment was made that by making it more explicit in the report about work with leisure trusts. Was there anything more that you'd like to add about that particular comment?
And examples of how they've worked with leisure trusts and also local sport governing bodies on accessibility to leisure and recreation. Not just GP referrals, so you shouldn't have to wait until you get ill or you feel that you need support before you get access. Classes, guidance, support within leisure. So and plus if there's any kind of projects that have been started and they're still running or completed, and what the results were from that. It's such an expansive subject matter, social services. It covers so many different ailments, illnesses, special needs, but just a bit more kind of more examples as to what's going on where, and has it been a success, could it be improved within leisure and recreation and social and health.
Can I suggest as well, Neil, if that's okay, can you, just from a Newport perspective, it might be handy to send out to the group again the report we received from Newport Live, if the slides are available, just because that covered lots of this and that might partially answer Councillor Pym's questions, at least for the city, as opposed to the wider Gwent area.
Yeah,
thank you. Chair, your comment about the rapid rehousing action plan. Doing great things, wondering if we can get any information, is there any way to get more information about and understand how we're going to not use the BMB? I'm not, we're waiting to hear back from the head of housing and communities at the moment.
Yes.
for the Rapid Rehousing Action Plan to come to the Place and Corporate Committee. Still waiting on the date for that. I can let this committee know what's going on with that part of work. But Sally said that she can get back to us about the RPB element side of the bed and breakfast.
Yeah, that'd be lovely.
And also, one of the big ones was about us sending a letter to Welsh Government in regards to the tapered funding.
Yes. Shall we talk about that separately, Neil? Once I think Phil said he would send us his letter, so we can take a lead from that, can't we?
Do that, yes.
And then we can pull that together and then send it out to the rest of the committee just for comments and approval. If that's okay.
Fine, thank you. Is
there any urgency in getting that letter?
Yes, I think we'll have to do it quite swiftly because they'll be talking about budgets now. Because if you think we'll potentially, well, our budgets are already being looked at for 24-25, aren't they? So yes, so we'll act quite rapidly on that one. As soon as Phil comes back to us, we can move on from there.
I'll get in contact with Phil as soon as this meeting's over.
The issue I raised was obesity, whether social services have a strategy.
Is that on the next report, Matt?
I raised it with the first report.
Fabulous. Okay.
And just whether social services have got a strategy in place, or whether they've got a cross partnership strategy with health, or how best they can cope with the increasing levels of obesity within the region.
So that's everything I've got for the area plan. Was there any other comments or recommendations that the committee would like to make about that agenda report?
No, I don't think so. I think that.
And I'm just going to the annual report. Councillor Drew's comment about the case study on Crick Road. Mentioned it was really an innovative project. Is it going to be modelled elsewhere? So Phil is going to take that back to the Housing Partnership. So we'll put that down as a comment and recommendation, and when we get the information back from Phil, it's sent out to the committee. That's what I got at the moment. It was your comment, Chair, about viewing first to see the Welsh Government grant funding used to provide for the unpaid carers.
Yes.
Explore how we can improve the uptake and get more from it. Was there any other further that you'd like me to add to that comment?
No, that's absolutely fine. That's absolutely fine. Thank you.
Other than that, it said a comment noted the annual report, but aside from that, there's nothing more I took. Was there any further comment?
Chair, am I allowed to raise something that I didn't raise during the meeting?
Maybe we could write to the officers, because obviously they're not here to answer at the moment. We can take that back to the officers.
It was just in, any plans for improving facilities within the city and for in socially deprived areas.
I think that would probably be one for Newport, because this looks at Gwent as a whole, as opposed to specifically the city. So that probably needs to be one from one of the partner groups that feeds in. Would I be right, Neil?
Yeah, that would be it.
Yeah.
Okay.
So aside from those two, was there any other comments, recommendations in regards to that report?
No, again, maybe we mentioned the funding and the worries around the tapering and the impact that it would have on this. I think you mentioned that, didn't you, Pat?
Yes.
Yeah.
But we are actually writing, aren't we, about tapering?
Yes, we are on the first report, but it's worth noting that we mentioned it against the second report as well, I think.
Okay, yeah, fine. Yes.
Yeah.
That's why I actually brought it up.
Yeah.
And I thought, ooh, Phil, he went off on a different tack.
Fabulous.
I'll get
I think that's everything. Does everyone agree?
Yeah. I get these comments, recommendations approved and sent out to officers as soon as possible, because mindful that it's going to cabinet and council to be approved as well, so we get them sorted. The next things just on my own supervisor reports, Chair, is just the forward work programme update, and our next committee meeting is on Wednesday the 8th of November, 5 o'clock on a Wednesday again. We'll have Newport North coming. They've been for the last couple of years now, so it'll be that annual report update on how they've been doing and the hitting the targets. That will be Wednesday the 8th of November at 5 o'clock.
Fabulous.
We'll also be discussing the draft Safer Newport Strategic Needs Assessment. So we'll just be asked to provide feedback on the draft assessment. It's the final version of it will later come back to committee. I think it's in the Mawrth meeting for us to comment on that.
Great.
And, in December the 6th, Wednesday at 5 o'clock, we'll have the violence against women and domestic abuse and sexual violence. Again, this is a statutory document, comes to us every year. And we'll have the EAS value for money report, which again comes every year to us.
Perfect.
Time is that the 6th then?
Well, that will be 5 o'clock again.
Will that be 4:30 for the pre-meeting, Neil?
4:30 for the pre-meeting, yeah. Apologies that we had to, this was the only slot we could have moved today. Meeting, and it's 10 o'clock, so again thanks to everyone for being able to be so flexible with that as well.
Thank you.
And that's it on my side, Chair. With the next agenda, we'll include the 2 lots of minutes from the 2 previous meetings, and we'll also include our committee action sheet as well.
Brilliant stuff. That's wonderful. Thank you, everyone. Thank you for all attending, and to those of you who've joined us online, and obviously to the officers and Councillor Hughes. I think, is that it? I think we're done, aren't we? Thank you very much. Thank you, everyone.
Thanks. Thank you. Bye.
Thanks.
Bye.
Bye. Bye.
Enjoy the conference.
Yes.